Hi, I'm Jean with At Vancouver Massage, and today we are featuring Sarah Peterson. I want to introduce Sarah. She's one of our massage therapists here at Vancouver Massage, and she's doing a little sampling massage here on one of our clients, and I just wanted to give you a chance to get to know her better. So Sarah, what guided you? I mean, what was like the thing that happened in your life that you became a massage therapist?
Well, Jean, actually, that is a good question because massage is something that I found in my recovery journey. And I had never had a massage before. And at the time, I was a barber. And so I sought out a massage and I thought, this is really cool. I would love to do this for people because it really brought me back into my body, brought me back into awareness of my body. So
you discovered it along your own healing journey.
Yeah.
I
Discovered that I was kind of a healer in a sense.
And so how long have you been doing massage therapy?
About 5 years.
Okay.
Yeah.
All right. And what was the school that you went to learn this?
East West.
Oh, East West. Okay. Fantastic. Do you find that there are certain areas of the body that people come to see you, like they're drawn to you because you are like really good at that area of the body, or like for instance the psoas? Sometimes people are really good at working on that part of the body. So do you find that there's an area that...
Well, I see a lot of people that are coming in with acute injuries, whether it's from a car accident or a sports injury. And that can kind of present itself as any number of things. But what I really enjoy doing is walking that person through their journey out of pain and discomfort and into functionality.
So one of the areas that you work with people that have injury is myofascial release, right?
Yes.
Yeah. So tell us a little bit about how that works, what you feel it's doing for the body.
So I'm not an expert in fascia per se, but from what I understand, it's kind of that layer on top of the muscle that resembles cellophane, and sometimes that can get kind of like congested, and so it's really beneficial to just kind of work that out.
Yeah. I've received Sarah's myofascial release, and it's top notch. So in the body, fascia or connective tissue is every other layer. And so it can get restricted, it can get congested, and that's through injury, dehydration, scar tissue. So releasing that fascia is super duper important in relieving restriction, and it can impinge nerves as well. So a lot of times when people are in pain, it's because their fascia is restricted and compressing on a nerve. So you also have a special way of connecting with your clients, Sarah. You know, just your personality and the way that you're able to communicate with people.
Yeah.
I almost kind of put you in the category of the therapist, right?
Yeah.
So she works on those that are working on others, really well. So I see other therapists that come to see Sarah and really enjoy her treatment work. Because when we're therapists, we definitely need to be taken care of as well. Do you do any stretching at all throughout your massage?
Yeah. I like to incorporate like resistance stretching. And so I'll put you into like a stretch position, and then I'll have you push up against my resistance, and that will cause your muscles to contract and then relax.
New to massage, a lot of times you're not always sure how the draping process works and how you're going to stay safe on the massage table. So Sarah's going to show us how she's going to undrape the area that she's going to work on, and then she's going to show us how she does some stretching. So Sarah, if you wouldn't mind showing us how you...
Sure.
are going to undrape
So first,
the leg.
let the client know. So Sarah, I'm going to go ahead and undrape your leg. And so what that looks like is I just kind of bring the blankets over like this. So everything's covered except for the area that we're going to be working on. Now in school, they taught me to like, pull everything through and make sure that my draping is like top notch.
Mm-hmm.
But I'm a little bit more lax than that now that I've been doing massage for a little while. And so mine never looks quite this good, but modesty is always preserved. And I always make sure that my clients are comfortable and feel covered. It's important. Sarah, I'm going to bring your leg up like this, and you just go ahead and relax, okay? Let me do all the work. So just let your leg, yes, perfect. And so what I'm going to do is I'm going to go ahead and bring it up and get it into a nice stretch until you feel it. You feel that stretch? Okay, so go ahead and push against my hand. About 50%. Keep going. Nice, steady pressure. And relax. And then I'll just kind of bring that back a little bit further down. Does that feel okay? All right, go ahead and push.
And for those that are super tight, after she lets go of the resistance, it allows that stretch to go even farther each time.
Okay, go ahead and push. Keep pushing. Nice steady push. Okay, and relax. And so yeah, I'll do that about 3 times, and then I'll put a nice deep stretch in there, and then I'll bring it back. Sarah, does that feel like we got some space in that area? Yes. Okay. What muscles did you feel like it was triggering or activating?
Central quad area.
Okay.
She said the quad area. Yeah. So that's the front of the leg, the large muscle group in the front. You just really shine with people. Like, what's your strengths?
So I would say that my number one strength is connecting with my clients, wherever they're at. If they come in and they're in acute pain, if they come in and they're cranky, I love working with patients like that, people like that, because I love to see the change that happens. And so when they're on my table, either naturally a conversation starts up or it doesn't. But a lot of times that will look like talking about whatever comes up.
Yeah,
really.
what's going on for them?
Whatever's going on for them. And, sometimes we laugh, sometimes we cry, but I'm there with the client, and it's really important that I give them that time.
And do you offer all the upgrades that we do here, the cupping and the stones and the essential oils? Yeah, that's great.
Yeah. For me, my life experience is really what contributes to me being a good therapist, because I'm able to relate on so many different levels and really kind of have compassion and understanding for where people are at in their journeys, where they're at in life. And so really, my job as a massage therapist is just to hold space, and so that, that awareness can happen for the client, whatever they need to learn or know about their body in order to be able to heal themselves, which is totally possible. One little piece of my story is that I used to be insulin dependent diabetic because I was really unhealthy, I was able to change that through lifestyle changes. and just making better choices, you know, which is part of the reason that I'm a massage therapist today. And so it's just really important to let people know that it is possible to heal yourself from, you know, different things. Maybe not everything, but you can definitely work with it better if you have more awareness, I guess. But yeah, homelessness and addiction, you know, all of that's part of my story. But also recovery is part of my story. Yeah, I really just enjoy helping people feel better in their bodies. You know, it's really just that simple.
I want to thank you for joining us today and giving Sarah an opportunity to introduce herself to you. She's available here on our scheduling calendar, and we really look forward to giving you the opportunity to experience Sarah's massage.
Thank you, Jean.